You have been treating it like dandruff for years. You have tried every shampoo on the shelf, the blue bottle, the green bottle, the one your friend swore by, the medicated one the pharmacist recommended, and it has never gotten better. Maybe it gets a little better for a week. Then it comes back. The flaking, the itch, the redness along your hairline, the white flakes on your dark shirts that make you self-conscious in every meeting, every dinner, every photograph. Here is the thing nobody told you. If it keeps coming back no matter what shampoo you use, it was probably never dandruff. Dandruff and scalp psoriasis look almost identical from the outside, but underneath the scalp surface, they are completely different conditions with completely different causes. And that is exactly why treating one like the other never works. This video is going to change that. In the next 8 minutes, you will learn 4 things. Why scalp psoriasis and dandruff look the same but are completely different conditions, and how to tell them apart. What is actually happening under your scalp surface when psoriasis is active? Why winter makes it dramatically worse, and what to do about it? And how scalp psoriasis is properly treated, including why the timing and method of treatment matters as much as the product you use. Let's start with the number that matters most. Research suggests that a significant portion of people currently using anti-dandruff shampoos actually have scalp psoriasis and have never been correctly diagnosed. The reason this happens is straightforward. Both conditions produce white or silvery flaking on the scalp. Both cause itch. Both can be worse in some seasons than others. Without knowing what to look for underneath those surface similarities, patients self-diagnose dandruff and reach for the nearest shampoo. The problem is that dandruff shampoos are designed to address yeast overgrowth on the scalp. That is what dandruff is, an imbalance of a naturally occurring yeast called malassezia that causes accelerated skin cell shedding. Scalp psoriasis has nothing to do with yeast. It is an immune condition, the same overactive immune system that drives plaque psoriasis on the skin, driving accelerated skin cell production on the scalp. A shampoo targeting yeast will never touch that immune process. This is why the shampoos never worked. Not because you were using the wrong brand, because you were treating the wrong condition entirely. Here is what is happening under your scalp when psoriasis is active, and why it looks and behaves so differently from dandruff, even though the surface symptoms are similar. In a healthy scalp, skin cells complete their full growth cycle in about 28 days. They form at the base of the skin, mature, rise to the surface, and shed naturally. So gradually, you never notice it. In scalp psoriasis, the immune system sends inflammatory signals that tell skin cells to complete that cycle in 3 to 5 days instead of 28. The result is a massive buildup of immature skin cells at the scalp surface that pile up faster than they can shed. This creates the thick, adherent plaques that characterize psoriasis. Notice the word adherent. This is one of the most important differences between dandruff and scalp psoriasis. Dandruff flakes are loose. They fall easily onto clothing. They brush off. They are the normal shedding of dead skin cells accelerated by yeast activity. Scalp psoriasis scale is not loose. It sticks to the scalp. It is thicker, more silverish white, and harder to remove because it is the result of rapid cell buildup rather than normal shedding. When it does come off, it often takes clusters of cells together rather than individual flakes. The redness is also different. Dandruff produces mild scalp irritation. Scalp psoriasis produces genuine inflammation. You can often see or feel the redness and warmth at the edges of plaques, particularly along the hairline. Here is the practical guide to telling them apart. 5 differences you can observe yourself. Flake appearance. Dandruff flakes are fine, white to yellowish, and oily in texture. Scalp psoriasis scale is thicker, drier, and often described as silvery white. If your flakes look almost like tiny pieces of silvery skin rather than powder, that is a psoriasis signal. How they come off. Dandruff brushes off easily. Scalp psoriasis scale often requires gentle loosening and may come off in larger sections. Forcing removal is painful and can cause bleeding, which itself is a strong psoriasis indicator. Hairline and beyond. Dandruff typically stays within the hair-covered scalp. Scalp psoriasis frequently extends beyond the hairline onto the forehead, behind the ears, and onto the back of the neck. If you have redness and scaling outside your hairline, the probability of psoriasis increases significantly. Response to antifungal shampoos. Dandruff typically improves with antifungal or zinc pyrithione shampoos within a few weeks. If you have used medicated dandruff shampoos consistently for more than a month with no improvement, that is one of the clearest diagnostic signals available. Associated symptoms. Scalp psoriasis is more likely to be accompanied by psoriasis elsewhere on the body, elbows, knees, lower back. If you have skin symptoms elsewhere and scalp flaking, the connection is significant. If 3 or more of these apply to you, talk to a dermatologist. A clinical diagnosis changes your treatment path completely. If your scalp psoriasis follows a seasonal pattern, worse in autumn and winter, sometimes better in summer, you are experiencing one of the most well-documented triggers in scalp psoriasis management. Here is the biological chain of events that happens every winter. Cold, dry outdoor air strips moisture from the scalp and stresses the skin barrier. The skin barrier is the protective layer that keeps moisture in and irritants out. When it is stressed, micro cracks form in the scalp surface. Those micro cracks do 2 things simultaneously. They make the scalp more permeable to irritants, and they activate immune sensors in the skin that treat the barrier disruption as a threat, triggering an inflammatory response. That inflammatory response activates the same immune pathways that drive psoriasis plaques. The result is accelerated skin cell production, thicker scale, more itch, and more redness. There is a second winter trigger that most patients do not think about. When you come inside from the cold into a centrally heated building, the air indoors is often extremely dry, sometimes drier than outdoor winter air. That transition, cold outside, dry heat inside, subjects your scalp to 2 separate barrier stresses in rapid succession, multiple times a day. This is why scalp psoriasis so reliably peaks in the coldest months, and why winter management requires a different approach from year-round care. 4 habits that make a measurable difference for scalp psoriasis in winter. Humidifier. Adding moisture back into your indoor air directly counteracts the dryness that stresses your scalp barrier. A bedroom humidifier running overnight is one of the lowest cost, highest impact interventions for winter scalp psoriasis. Water temperature. Hot showers feel good in winter, but they strip the scalp barrier further. Lukewarm water, warm enough to be comfortable, cool enough that steam is minimal, significantly reduces the barrier disruption that triggers flares. Protective covering. In very cold weather, a soft hat or hood protects the scalp from the cold air that initiates the barrier stress chain. Choose soft natural fabrics. Wool directly on psoriatic scalp can irritate. A thin cotton liner under wool is better. Consistent treatment timing. Winter flares move faster than summer ones. Waiting until a flare peaks before treating means you are always catching up. Consistent nightly treatment during the winter months, applied before symptoms intensify, is more effective than reactive treatment after a flare has established. Scalp psoriasis treatment works on 3 sequential steps, and the sequence matters as much as the products. The first step is scale removal. Before any medicated treatment can reach the scalp tissue, the scale layer needs to be addressed. This is why salicylic acid is a cornerstone of scalp psoriasis care. It is a keratolytic agent that softens and loosens the scale buildup, making the scalp surface accessible to treatment. Applying a treatment directly over heavy scale is like painting over a dirty wall. The preparation step is not optional. The second step is addressing the inflammation. Coal tar has been used for scalp psoriasis for over a century and remains one of the most clinically validated topical treatments available. It slows the accelerated skin cell production that creates scale, reduces inflammation in the scalp tissue, and decreases the itch cycle. It is applied after scale removal, so it makes direct contact with the scalp rather than sitting on top of accumulated cells. The third step is barrier protection. After treating, the scalp barrier needs support, particularly overnight when the skin is in repair mode. Consistent moisturizing treatment applied at night and left on through sleep gives the skin its longest uninterrupted window for recovery. This is precisely the approach Nopsor was built around. Both the shampoo and the pomade are formulated with coal tar, salicylic acid, and the 8-herb herbal blend. The shampoo step exfoliates and prepares the scalp while delivering the formula during cleansing, and the pomade applies the same active ingredients in a moisturizing base designed to absorb and work overnight. Applied nightly, this 2-step sequence works with the skin's natural overnight repair cycle, which is exactly when scalp psoriasis treatment is most effective. If you have been frustrated for years by a scalp condition that never fully responded to treatment, you now have the most likely explanation for why. The shampoos were not failing you. You were treating the wrong thing. Scalp psoriasis is manageable. Understanding what it actually is and what is happening underneath the surface is the foundation of treating it effectively. This video is part of a complete psoriasis education series on this channel. The playlist covering psoriasis treatment in detail is linked below, including videos specifically on winter flares, the dandruff comparison, and the nail and guttate psoriasis guides. Nopsor is a steroid-free two-step nighttime system for psoriasis, formulated with coal tar, salicylic acid, and 8 natural herbs. If you are managing scalp psoriasis and looking for a consistent nightly routine that addresses both the scale and the inflammation, learn more at nopsorusa.com. Subscribe for new psoriasis education videos every week.